Hello, everyone, and welcome to another episode of the Wise Decision Maker Show, where we help you make the wisest and most profitable decisions. My name is Dr. Gleb Tsipursky. I'm the CEO of Disaster Avoidance Experts, the future of work consultancy that sponsors the Wise Decision Maker Show. And today I'm joined by Sam. Sam, can you introduce yourself and share a little bit about what you do?
Sure, yeah, it's nice to see you, Gleb. My name is Sam Mandel. I'm the co-founder and CEO of Ketamine Clinics Los Angeles, and we have been a provider of ketamine infusion therapy for mental health for nearly a decade now, and we're one of the first ketamine clinics to open in the United States in 2014.
Excellent. Now, ketamine has been growing, of course, increasingly popular, and it's pretty radical treatment in the sense that it works much faster than SSRIs. Can you tell me a little bit about what caused you to decide to provide this service and what kind of impact you're seeing ketamine having?
Yeah, so the field of mental health in the US has really been stagnant for, about 50 years now, and there has not been a lot of innovation. Many of the drugs that are prescribed, prescription antidepressants and mood stabilizers, antipsychotics, and other classifications of medication have really been within each class more or less copycats of one another with only minor changes. And they have not worked particularly well. They are important. They do help people. They are a tool in the toolbox, but the mental health crisis has continued to spiral out of control, with depression now being the leading cause of disability in the United States and actually the leading cause worldwide. Anxiety skyrocketing. All these numbers have been going up substantially, even pre-pandemic. The suicide rate has exploded and continues to grow every single year, and it has pretty exponentially now for about 20 years. And so these solutions are not meeting the need of what's going on for people. So when we first learned of the early research in the early 2000s on utilizing ketamine for mental health, we got very excited because all of the results were really overwhelmingly positive in producing relief for patients more reliably, more quickly, better quality relief, and safer with fewer side effects than any of the other conventional treatments. And that's with IV infusions of ketamine. And so lots of our friends and family have suffered from mental health challenges. We've lost too many people to suicide, including this year. And it is a personal quest for us, a passion of ours. And so that's why we are here today.
Excellent. Now, tell me a little bit about what someone would experience. I know that unlike traditional SSRIs, ketamine provides very quick relief, although it's shorter lasting. So tell me a little bit about what someone would experience after receiving an infusion of ketamine.
Yeah, so just to kind of compare a little bit, an SSRI you take every day, and if you don't take it, it doesn't work. It leaves the system rather quickly. If you discontinue it, depending on the therapeutic dose you're at, you might feel okay for a couple days, but you're going to have withdrawals and most likely, and you're definitely not going to work anymore once it's out of the system. With ketamine infusions, it's a different model. You have a series of 6 infusions over 2 to 3 weeks. Each infusion is about an hour long. It's in our office here in Los Angeles in the Culver City area. And patients come in, we make them comfortable. They recline in a chair. They receive pillows, blankets, noise-canceling headphones, a sleep mask, because it's the experience during the treatment is also very important. So we make them very comfortable in a very serene environment, have a very compassionate and attentive care team of a variety of clinicians. There's actually 17 of us here at this one location. So we have a big team. Everyone gets lots of individualized attention. And they have the infusion. It's IV, so it takes about an hour. And then there's a little bit of recovery time afterwards. That's the kind of high-level overview of it. But in that period of 2 to 3 weeks, in those 6 infusions, patients are getting months of relief. So they're not taking ketamine or any medicine every day. And so there's effects that occur both psychologically and on a neurochemical level from the treatment that persists long after the medicine has left the body. So ketamine has a short half-life. It's not like it stays in the system long.
Yeah, it's my understanding.
It's out of the system mostly within a day. But it's meaningful changes that it causes during the infusion process that are actually long-lasting. A lot of the early research was one single infusion. And
Mm.
that's when people said what you were saying, Gleb, is, yeah, it works, but it doesn't last. However, the series of 6 in a 2 to 3 week period can help to create lasting change. And on
Interesting.
average, patients get about 3 months of relief, and it
Mhm.
varies widely. Some patients only get maybe 1 month,
Mhm.
which is not typical, but it can happen. And then there are patients who will get 6 months or a year, or in even rare cases, we have a handful of patients we're tracking who have actually gotten 2 years of relief,
Hmm.
one series of infusions, no additional follow-up, no other medications, and they're feeling great. So, those are the outliers. That's not the
Yeah.
norm, but it's absolutely possible. But on average, it's about 3 months of relief.
Okay.
And at which point people come back for follow-up treatment, or we refer to them as booster infusions, and
Mhm.
then they get just 2 infusions a day or 2 apart. And that really extends their initial benefit another, 2, 3, 4, 5, 6 months, depending on their situation. So the maintenance is
Mhm.
not another whole series, and we really do it on an as needed basis
Okay.
to individualize it per the needs of the patient.
Interesting. So tell me a little bit about how you work with other medical providers, with therapists, with psychiatrists. What is is the ketamine sometimes, clearly sometimes you do it just without any additional medical support, but does it work better? I would imagine it would if combined with therapy, CBT of various sorts. And also, how do you work with people who are in SSRIs and who also want to try ketamine? So let's talk about those two issues separately. Let's start
Sure.
with therapy and tell me a little bit about the combo of therapy with ketamine.
Sure. Yeah. So there's a number of different approaches around this. We're big advocates of talk therapy.
Mhm.
The doses we're using to provide the most transformation for people during the infusion are not really conducive to talk therapy during it.
Sure.
There are some providers who are doing lower dose treatments and actually doing ketamine assisted psychotherapy, or CAP.
Mhm.
The patient is actually in a psychotherapy session while they're under the influence of the medicine.
Mhm.
There can be good work done that way with certain types of patients, but in our experience, most patients benefit from having an individual journey during the treatment where they can
Mhm.
have self-discovery, revisit past trauma with clarity without being triggered by it or having an emotional response to it, gaining insight about themselves and the world around them, feeling more connected and empathetic, and really having a meaningful experience to themselves that they can then go and process in therapy separately, be
Yeah.
it next day or later that week, and kind of unpack what might come up for them with their therapist.
Mhm.
We don't have therapists in house. We're big advocates of it. We refer out for that
Mhm.
service. Most of our patients are already working with a therapist, so we respect that relationship, and we encourage them to bring any kind of material that might come up to them.
Mhm.
Now, our nursing team is fantastic, and they'll help patients to process a little bit of their experience with some kind of integration afterwards, but they're careful not to really dive into therapy because there's a difference there, of course.
Yeah.
And a lot of that work is really better done when the patient's not altered by the medicine.
Mhm.
So we will encourage them to journal. If they share some insights, we'll encourage them to make sure that those things are brought up with their therapist, or we refer them to someone for that. Now, we have a pretty diverse group of clinicians. We have 2 psychiatrists, a
Hmm.
psychiatric nurse practitioner, and then a team of 4 registered nurses. And so there's a nice variety of backgrounds and perspectives that the patient benefits from during their time here. And then we have an entire administrative team as well, but they're obviously not involved in the direct
Sure.
patient care. And so we will probably incorporate psychotherapy in-house at some point, but
Hmm.
we haven't really had a need. And also there's just, when you have a community that you can refer out to, you can really find the
Mhm.
right type of provider for that patient's unique needs in a way that would be very hard to do in-house. Because if they want a man or a woman or
Mhm.
CBT or DBT or someone who specializes in trauma or someone who specializes in, marriage and family therapy, or, there's so many different things that people need to really
Sure.
do meaningful work. It's better, up until now, at least, it's been better for us to connect them with the right individual with a larger network of individuals. So that's kind of our approach with that. Other treatments, it can be coupled with it. Most people are still taking some sort of a prescription medication,
Mhm.
an SSRI or antidepressant, or they
Yeah.
might be taking anti-anxiety medications. There's no contraindications there. It's totally
Mhm.
fine for patients to continue taking their meds as prescribed during the treatments. A lot of patients do come to us wanting to reduce or eliminate meds because they produce negative side effects.
Oh, sure, yeah, that
They're
makes
not
sense.
working. And a lot of people end up on these meds for life, and they just take them every day because they don't know what else to do. And they figure, well, I'm not feeling good, but maybe I'd be worse without it. And they just go, and it's so normalized, for everyone to take pills every day in the United States that it's just what they do. We really feel that if medicine isn't actually providing you with a meaningful change, meaningful improvement, and especially if it has negative side effects, you should probably get off of it. And so we have patients who will work with our psychiatrist to do that, or we will encourage them to work with the psychiatrist that they might be seeing, if they're currently seeing someone, to consider doing that for them. A lot of patients are actually prescribed by, family physicians, internists. They actually write more antidepressant scripts than psychiatrists do. So a lot of the time, those doctors don't have the training or background or even the time to give really good psychiatric care.
Yeah.
So, that's a little bit of an issue. But I don't know if that fully answered your question.
That does. So I want to follow up specifically on the medication. Of course, medication can cost quite a bit depending on the kind of medication that people are taking. So I'm curious about your business model. What is the business model for your ketamine clinic? How does it work? Who pays? Tell me a little bit more about that.
Sure. So it is cash pay. Ketamine is not covered by insurance at this time, except we do have an agreement with Kaiser SoCal for some of their patients to be referred to us. And that's up to the provider over at Kaiser. Individual providers will determine whether or not they want to refer their patient for treatment. If they do, they will send the patient to us to treat them. And Kaiser SoCal will pay for it in some cases. Other than them, none of the other payers are really paying for ketamine for mental health, which is really unfortunate. And it's something that we're working on changing, because it's actually a faster acting, safer, more effective treatment than the treatments that they are paying for. And in addition to that, the insurance companies would actually save money because they're spending a lot of money on these other treatments that are not as effective. And if they paid for ketamine instead, they would actually make more money, which is unfortunately their primary concern. So it's really an all-around win if they start to catch on to that. And some of them are starting to realize that. The reason why is because ketamine is an FDA-approved anesthetic. It's been around since the 60s. It was approved in 1970. However, it was approved as an anesthetic and not as a mental health treatment. In the United States, you have to have a approval for a particular population and indication and protocol. So what we're doing is considered an off-label use. Off-label is very common practice. It's totally fine. 1 in 4 of all prescriptions are prescribed off-label. About 1 in 3 of all psychiatric medications are prescribed off-label. And any doctor can prescribe any medicine for basically anything they want to, as long as they feel like they have a good basis to support that decision. And so there's a lot of clinical research proving ketamine's efficacy. As a matter of fact, there's about 170 trials that have been done at leading institutions, Stanford, USC, UCLA, Harvard, National Institute of Mental Health, Johns Hopkins, Cleveland Clinic. I mean, the list goes on and on. Pretty much every major scientific institution, university has done at least one study on ketamine for depression. So it's very well proven, very well researched. However, the FDA doesn't approve things based on whether or not they're good or whether or not they're researched by others. They have to be done per their policies. And that can cost tens of millions or more likely hundreds of millions of dollars to get the approval. Because ketamine was synthesized in the 60s, the patent is up. So no one's going to spend that money because they would never get it back. Ketamine is now a cheap generic drug that is manufactured by at least 5, 6, 7 different companies. And it's not something that if you paid to get done, you could make your money back by selling ketamine. And so that's why it's kind of slipped through the cracks here with all of this, and with being even more mainstream than it currently is, and with the insurance piece. And insurance companies will love to say, oh yeah, it's not FDA approved for this use, it's experimental. we're not paying for it, because they love to find reasons not to pay for things. Their MO is not to write checks. It's to save the money they have from their premiums and invest it and grow it. But that's kind of, and I don't mean to get too much into the weeds, but I want to explain
that's helpful.
some of the context here so people understand, because when we talk about ketamine and what an amazing treatment it is, so many people will then say, like, well, why isn't it FDA approved if it's so great? Why doesn't insurance pay for it if it works so well? How come I haven't heard of it? Why didn't my doctor recommend it to me if it's so great then? What's wrong with it? Well, these are the things that are, quote, what's wrong with it. It really comes down to money and politics. The treatment itself works within a couple of days. It works 83% of the time in our clinic. SSRIs are like 35, 40%. I mean, they're not that much better than a placebo, and they often are the results are short-lived. They stop working after a while, and people have to take higher doses or different meds because they just stop. Ketamine works in days. It works 83% of the time. It has no side effects, none of the side effects that are long-term that these other meds have, like weight gain, loss of libido, dry mouth, vision, all the common ones that are really problematic with SSRIs. Ketamine has none of them. And the quality of relief is really unmatched. With SSRIs, a lot of people say that they feel like they're able to get out of bed and go to work. They feel maybe like they can get through the day, but they don't have joy. They're not happy. They're very flat. The spectrum of their emotions is narrow, and they don't go too low, which is nice, but they don't go very high either. With ketamine, people really get the restoration of pleasure. They really get more compassion for themselves and others. They're energized. They're motivated. They are living life fully again in ways that I'm telling you, people will share they haven't felt like since they were a kid, or they haven't felt that way in 20 years, 30 years. So it is a really restorative treatment. And again, that happens on a neurochemical level with a totally different mechanism of action than these other drugs. It affects the brain in totally different ways. And also on the psychological piece, the experiential component, where people can really process and heal, not just treat symptoms, but really get healing at the root cause of their issues.
Excellent. Well, now as we're finishing up, what are your thoughts about how ketamine will be used in the future, and what is the future of ketamine in the US?
Yeah, that's a good question. When we first started, we wished there were more people doing this work because there was no one around. I mean, we had people flying in from all over the world to us because there was no one for treatment. I mean, Italy, France, Australia, you name it, all over the country. And we still have some of that, but there's a lot more places closer to where people live now. But now, fast forward 10 years, and instead of wishing it was more widely available, we're wishing that there was more high quality places out there, because there's a lot more people offering it who are really, frankly, don't know quite what they're doing. They might be well-meaning, but they don't really have the skills or the experience or the knowledge to do the treatment well. And then there are people that are exploiting this, and we see this as an opportunity to get in on a rapidly growing industry and to try to make money, and who don't really care about patients. We really don't want people going to either of those places. We really want to see more high quality centers out there. In terms of the future of the treatment, I think it will definitely continue to become more widespread, more widely available. Hopefully with that means more good, high integrity providers offering it. I do think that insurance is going to start covering it more. We have started to see some larger networks considering that, starting to do it. I mean, Kaiser SoCal is a large institution. I heard that Blue Cross in Massachusetts is got a program where they're starting to cover it. I think more and more insurance networks are going to start to see that this is not only an opportunity to really have an impact on human suffering, but it's actually an opportunity for them to save money. And so I think that will really move the needle forward. I don't know if it's ever going to get the FDA approval that it deserves. I would hope that maybe someone philanthropic would be willing to pay for it just for the good of mankind. A Gates Foundation or something like that could go through that process. Maybe the FDA, I don't know the details of how the FDA works, but maybe there's enough other clinical data out there. They might make an exception because this is such a national crisis with, 45,000 people completing suicide every year. And with depression being such a leading cause of disability, maybe there would be some sort of an exemption for fast tracking, adding this indication, because again, it's an already approved drug, but adding another indication for it. So ketamine, the anesthetic, is now also ketamine, the antidepressant, right? That's possible. I don't know. And yeah, I think, ketamine really has paved the way for other psychedelic medicines to become mainstream. And so what I think we'll see is not only an increasing accessibility to ketamine, but also the places that are established in doing that will be incorporating other innovations like psilocybin, like MDMA into those practices. And hopefully in the next 5 to 10 years, we'll see a complete, revolution in the way that mental health care is done in the United States. And we're excited to be leading the charge and kind of pioneering that path forward, as we have been for 10 years now. So the future looks brighter than yesterday from where we're sitting.
Excellent. That's really exciting. And I'm definitely know there's been some good news about recent approvals of MDMA and psilocybin use. So definitely very exciting. Well, thank you. This was very helpful. Really appreciate your time.
It was such a pleasure. And thank you for the great questions and for your time as well.
And thank you to the audience for checking out another episode of the Wise Decision Maker Show. Please make sure to subscribe wherever you checked out the show and leave a review. It helps other people discover the show, and it helps us improve the show. All right, everyone. I'll see you in the next episode of the Wise Decision Maker Show. And in the meantime, the wisest and most profitable decisions to you, my friends.